Good evening, ladies and gentlemen. Welcome to Lifestyle with Dr. Mobi. I'm Dr. Mobi. Today we are going to talk an important topic, and that's obesity. First, we're gonna go ahead and introduce our guest, and Dr. Jamil, we welcome you today.
Yeah, thank you.
So tell us about obesity. What we need to know about that. It's an important topic.
Well, it's almost an epidemic all over the developing world, including the area where it was not a problem. Now it's gaining the problem because they're getting more affluent.
Mm-hmm.
And sometimes when you think that obesity is always that somebody ate too much.
Mm-hmm.
I ask the people sometimes, how much did you actually eat? Well, they'll try to give a breakdown on the food they ate.
Mm-hmm.
And when you count it down, it's not that bad actually.
Mm-hmm.
And you always think that there has to be something more than just eating too much. And there is a bias as a whole against being obese in the United States or all over the world.
Yeah.
Because it is a problem to their health. It is expensive. They get sick. They have a lot of complications that people don't like to deal with. On the top, television, newspaper, they are always being very aggressive with a concept of health that is tailored to very thin person.
Mm-hmm.
So it is not only an issue with a physical problem, it also becomes a very emotional problem who are obese.
And that's important actually concept. So we are not here to tell that somebody is obese and it is bad. It is more to do with your health. So best is to actually, everybody is individual and genetic makeup determines actually how they are functioning. So get your blood test, get your health check, and if your doctor suggests that you really need to work on the weight, then work. If you are healthy otherwise and no other issues, then it's not a problem. Question, if we don't want to stigmatize obesity, it's not to stigmatize, it is actually to understand your body and adjust it according to your needs, your body needs more specifically, more genetically also. So everybody's genes are different. Any disease and effect of medication or disease process, it manifests very differently based on our genetic makeup. And that's the basic understanding of this topic we are trying to emphasize. So let's learn a little bit about different levels with obesity, what is BMI and how that can help or not help.
Okay. Well, there's one concept that used to see BMI. It has relation between weight and the height.
Mm-hmm.
As we get older, we have a loss of height. So somebody who is already at the margin can become overweight just because they lost 1 inch.
Yeah,
height. So we have to understand what causes the obesity.
Mm-hmm.
And it's just not eat less and move more will cure the problem.
Mm-hmm.
Because there's a lot of things to do with our brain. There's a small part in our brain in the middle which is called hypothalamus. It's almost like a thermostat. It controls temperature. It controls how much fluid you should have in your body. And it controls our appetite. There's a lot of sensor in our body, in your stomach, esophagus, everywhere else in the intestine that sends signal continuously to our thalamus to control our appetite, our satiety. And sometimes that can fail and gain weight. Sometimes there is a pleasure center in our brain too, like a hedonic center, and which talks to our hypothalamus and tells that, I'm happy now, you can stop the eating. Sometimes, our front part of the brain called frontal lobe, which is our, we develop as we get with your life in this world, and you train what is right, what is wrong, And that will tell you that when you're eating too much, your mind will tell you, hey, I think you should not eat this thing. It's not good for you. That is coming from your frontal lobe. So these are that plague that's going on between thalamus, hedonic center, and the frontal lobe determines how much you're going to eat or not eat. So when something breaks down, like frontal lobe issue, the control that says that don't eat it, does not get there anymore, you will gain weight because you start to eat more, because you lost one part of the control. It is not only weight issue, it is the complication that can give you all the problems that you're going to suffer. Other than joint pain or arthritis that we get from the just wear and tear, you will have cancer that related to the obesity. Some of the diseases like diabetes mellitus is also related with weight, gallbladder disease, and non-alcoholic cirrhosis of liver. A lot of time people have cirrhosis of liver, and we automatically think that must be an alcohol drinker. In the United States, number one cause of cirrhosis of liver is not alcohol. So you have to think about what else can be. We know that fatty liver can do a lot of problems, like a gout. It rarely seen in poor people who didn't eat too much. Used to call king's disease because only king will get it, because they have to eat a lot of protein and overweight. Now it is more common in everybody. Plus, you have to have genetics to do that. So the way you take care of your uric acid in your body. Sleep apnea syndrome is more common, I'll say, in obesity. There's a relation, the size of your neck and the obesity, and also the sleep apnea syndrome. So these are the problems that you can face as you gain weight. I was talking about the cancer. Colon cancer has been related to weight gain. Kidney cancer, esophageal cancer, uterine cancer, breast cancer, you name it, all has some contribution from the obesity. That is for everybody, whether you are younger or old. In older people, there is a lot of people. It'll be 88 million people by 2050 over age 65, and there will be a lot of people who will have this problem that we expect. And you're talking about the BMI, it is kind of problem.
Yeah.
We also take the waist measure.
Yep.
And sometimes if you combine basal metabolic index and waist circumference, these two combination probably a better indicator of the obesity. In a man, if your waist is over 37, you are probably at risk for problems. In women, it is 31 centimeter, 31 inch, not centimeter. So, as you say, height is also a problem. As you get older, we lose height because of osteoporosis and the bone getting compressed. So, you have to compare both numbers, circumference and the BMI, to tell somebody to obese or not. And there is a obesity products. It's not all bad about obesity. People have higher density of the bone or better bone if they're obese.
Yeah, so that's true. And for BMI also, I would like to again emphasize that there's a difference. So for everybody to know, normal BMI can range up till 25, but above 25 is overweight, and then we consider obesity. But it's very important. This BMI is a little misleading for male and female. So men can have more muscle mass, and unfortunately, weight-wise, it'll be still higher weight. So important concept is fat distribution, and especially the visceral fat. That's where the your circumference comes and plays important. A lot of diseases happen because of visceral fat, so not necessarily over total weight. So that's very important concept we want you to know. Other thing which I've seen is this BMI concept is should be different for different races. So for certain population like myself, this BMI of 25 actually means a lot of fat, visceral fat. So for us should be changed. In my opinion, it should be changed. And that so important concept is get your blood test, get maybe the fat percentage of your body, and that's a little more detailed eval than BMI is. And then blood test A1C to see if your sugars are okay, and see if you have any other metabolic problem. Other thing about weight is it's going to be very hard on the knees and joints, not only knees but all the joints including back. So whether if you don't even have any disease, then still your chances of having problem with your joints go way up. There are actually higher incidence of lot of problem with joints, knee replacement if you are overweight. So those are also very important concept. Then always concept becomes is why people or why we eat and overeat. First is we really need to understand the brain process. So part of the brain which controls our hunger is limbic system, we call it, or primitive brain, and one portion is the frontal lobe. The other portion, so that is a primitive part of the brain. Then there is of course more advanced portion which is human brain has evolved over the ages, and basic thing is this is a basic instinct. So food hunger is a basic instinct. We eat, but we have a control when we should say, and that I always say is called mindful eating, that you understand and you develop that when to stop eating and when you want to start. So that we have control, and we should have always control on that. Problem is not eating, is overeating and going beyond. And so you don't want to keep eating until you throw up and say, oh, that's the end of my eating. You can stop before that and give a break to your stomach and your body and your breathing, because you're going to breathe better once you have less food in the stomach. And I always tell people, look at, if we dump all this food in stomach and tell our body to absorb all that food, it is a lot of work for how the body is going to absorb by blood. Okay, so it's going to distribute all that blood to stomach and then gradually absorb. It's a lot of work for body. Be gentle to your body. That's all I'm trying to say for this BMA concept, is about the hunger. So also tell us about these effect of obesity.
Okay, there's a positive effect of obesity,
Yeah.
and as you know, your bone density will be better, and their memory loss is less than other people, and they have less malnutrition because they eat well, and the risk of going to a nursing home is also tied with the BMI. If your BMI over 35, pretty obese, they end up in nursing home more often than people who didn't. Even when they lose weight, they lose 75% of fat, 25% of the protein. So they have already have less protein in the body. When they lose more, they tend to be more frail. They have more risk to the complications. So it is always difficult for obese older people to lose weight because it can do more bad than good. To compensate that, they have to make sure that they eat well and protein amount. they need to have a little bit more protein in their diet so that they can compensate that weight loss. If they can lose weight, they'll be able to stay at home longer. I think that should be an incentive why they should lose weight.
Yeah.
And like anything else, if you have you talked about the lab work and the testing and things like that. We all test for blood sugar
Yeah.
and hemoglobin A1C to see how is the average blood sugar. Your fasting blood sugar may be normal, but your average blood sugar is always high. It means that you are probably diabetic. You need to be changing your diet somehow. Then you have to make sure that your thyroid is not underactive. And you have to check for liver enzymes to make sure that it isn't not causing some liver issues from fatty liver. And check the cholesterol to make sure that your risk for heart disease is not any higher than other people. Some of the medication that can cause weight loss gain, so those medicine has to be taken off if possible, because you tend to get help from every angle if you can. Like insulin, it is known to make more muscle or more weight, and sulfonylurea, like a glyburide or amyrol, these are related with weight gain. And some of the medicine is not connected with weight gain is probably metformin, and also Victoza is an injection form. It controls the blood sugar, but not related with weight gain. And there is some medication called Actos, Avendia, that class, that can cause weight gain. Glucose, steroid, we all know if you take steroid, we gain weight. And some of the antipsychotic medications. And for those people, it's very difficult to lose weight because there's a side effect. Smoking cessation is related with weight loss, weight gain. But I rather gain weight than smoke cigarette, because people who gain weight even after quit smoking, their prognosis is better than people who smoked. So it is always a good thing to quit smoking, irrespective of what. Like you can just looking at the people that may have some other disease, like a lot of acne and the polycystic ovarian disease, or has a changes in the hump and things like that, has a Cushing's disease or goiter and the hypothyroidism. So few things you can look into, just looking at the patient, whether something else you can do to change the thing for the weight gain, just not blaming people that you just ate too much.
Yeah. So it is more, understanding your body. It is responding and helping your body. So that is the main message here, is you have to listen to your body. So if and the other important thing is about liver. One of the important thing I see a lot of my patient happens is they don't understand how liver functions. So when we eat food from stomach and intestine, the whole, especially from intestine, all that absorbed by blood. So the blood will first send it to liver. It will kind of take everything out, most of it out, and try to process it. And if you give more than what it can handle, then it will develop what we call fatty liver, because it cannot get rid of all that. And then it will deposit as fat cell. Those can actually kill or replace your normal liver cells, and as a result, that is a leading cause, one of the leading cause of liver problems in US. So, which we call is not alcohol, although alcohol also is there, hepatitis is also there, and other diseases are there. But the biggest cause, or a very important cause, is fatty liver, and which is we call non-alcoholic liver disease, or NASH. And it is really something, when we do this scan, when we do CT scan, when we do ultrasound, we see the fat deposit all the time. We can see also from the blood tests, those enzymes are higher. AST we call that, or ALT, and those will show us that there's something wrong there. Same stands for an ultrasound. We do it, we can see actually the fat deposit, and those are very important concepts to actually absorb and understand. Maybe that will help somebody to understand the body better. Maybe that will really make them work on their weight issues because of those problems with liver.
That's what we can do about it.
Yeah.
And the treatment is still the same. You eat less and do more exercise.
That's it. Yeah, there are only two ways.
Two ways you can do.
Yeah.
And if you lose weight drastically, some people can have a problem with the gallbladder.
Yeah.
And when you lose weight, you have to change your medication because you need less medicine. Like change the blood pressure medicine because you need less. Your warfarin or coumadin dose has to be changed. Your digoxin has to be changed. You may need medicine for, if you need medicine for acid reflux disease, you may need less because that has something to do with the overweight. And you may need less medicine for joint pain because you're putting less pressure on the joint. So these are all the good stuff. There's a lot of medication you can take nowadays, but everything has a side effect. So you have to decide what you're going to take. Orlistat has been in the market for a long time. And it binds the fat and it comes out of your gut without absorption. And so side effect is excess gas and also diarrhea, some people.
Yeah,
and they don't like it. And there's a medicine nowadays approved for weight loss. It's a diabetes medicine called Saxenda. And so you can use that without having diabetes. You can take that control. Victoza is the same class. And there's a medicine called Contrave. It's a combination medicine of naltrexone and bupropion.
Okay.
So it also does some good, but you have to make sure that it doesn't cause nausea, headache. That is one of the problem. There is also the Quesmar. Quesmar is a medicine combination, phentermine and topiramate, which is good medicine. Side effect is tingling, peripheral neuropathy. Depression can cause. So it is always a trade-off what you're getting into. But if you can do strict diet and also exercise, you can probably get away from all the medication that can cause side effect. Weight gain should be managed as a chronic disease.
Yeah.
Like if you give an appointment for blood pressure patient to come every 3 months or 4 months, probably should do the same thing for obesity, so that you can go over his or her strategies, diet, exercise, and whether anything changing in your body. If there is a issue with the blood pressure, whether weight loss is causing the blood pressure to drop too much. So those things can be assessed when you look into this and do it on routine basis. Then set the expectation. They need to know that they're not going to be losing 200 pounds. They'll be, even if you lose some, it is a benefit they're going to get rest of their life. And discuss about the stigma of obesity and the psychological stress that puts on them. They have to know that this is not always their fault, and you're trying your best. And as it will be treated like diabetes and hypertension, routine visit, and call them up and say, how are you doing? And you can set up a support group where they can go and talk what is working for other people. Sometimes that does some good, and that also helps with your mental health too, to talk to the people who are suffering the same stigma and problems. Lastly, we talk about surgeries. And if you have a BMI over 35 and having a lot of comorbidities like sleep apnea syndrome, diabetes, hypertension, you can be a candidate for the surgery. And there is strict rules that you have to follow weight, diet, and to show them that you failed. Then you will be candidate for surgery, and there is a lot of surgery you can do nowadays. There's a gastric bypass that we know about and its complications. Then you have a sleeve gastrectomy, which is less invasive, and a lap band surgery. And some places are pretty good at it and has a good success rate. But if you are over age 60, then it's a problem. Problem is that they get more complication from banding surgery or gastric bypass surgery. So for those people, diet, exercise, and the medication probably better choice.
Okay, great. And also very important is for surgery, I always counsel them that problem with surgery is temporary fix. So it is not a permanent fix because problem is not in the stomach, problem is up here thinking. So so can we gain back all that weight after surgery? Absolutely.
Yes.
Because most of studies have shown 2-3 years later they fail surgery and now they don't have a big stomach but their weight is coming back. So all the problems also come back. What does it prove? Very simple thing, that we can do it without surgery also. We should do it. And without medication, I always also counsel that medications are never answer, they can help only. So they can actually discipline your life, that's true. They can help us, we all need help. But more important is counseling, support group. You need to make sure you get help. You get a help from professional, either doctor or dietitian. Show up every month, every week. Show your commitment, be disciplined, and you will achieve the success. Also, very important thing is for females, we should never stigmatize them that they need to lose weight. Actually, it's also for men, for both sexes. It is wrong to only hold female to this standard and tell them to lose weight or actually criticize anyone. So for that, I always say, please make sure that we educate and is for educational purposes only and play important role in somebody's health. So with these final comments, we'll take a break and also get any questions. If you have, give us feedback with Facebook, Twitter, and keep watching our show. Thank you, Dr. Jamil Ahmed.
Thank you.
Thank you.